Your knee up a little bit more. Okay, so this structure here is the quadriceps tendon. So this is patella. Here's your quadriceps tendon. So what we're normally looking for is an effusion coming up into the suprapatellar recess here. So this is prefemoral the patella. Look for prepatellar bursitis, and then we can see the origin of the patella tendon. Now,
this is your career retirement coming in now. If you need an excuse for it,
can someone take a photo? Yeah, in case I need to defer my marathon.
See, it works every time. Right, so can you just turn that dial there?
This one?
Yeah, turn it up. Make it nice and bright for us, yeah. Okay, so we can see that he has previously probably had an adolescent knee disease called Sinding-Larsen-Johansson syndrome because he's got an unfused part of his distal patella. Okay, so this is patella tendon running across the top there, but he's got this tiny little bit that's sitting off it. Is that correct? You have that? So you can see a lot from ultrasound and make assumptions that that's a PDI button. Is that PDI? Yeah, that one. And now you get to crank up the wheel again. And we can see if there's any signs of, maybe not that much, I'm trying to break it. So if we see increased power Doppler here, it might be a sign of acute reactive tendinopathy. In his case, it's probably a bit quiet. This is all just noise. Okay, turn that PDI off again. Then we go down, distal patella tendon, have a look at the deep and superficial infrapatellar bursa. They're completely normal, nothing going on there. Medial joint line. Okay, so here's the femur. Okay, so that nice round bone. This is the tibia. If we follow that MCL down, this is the bit that's quiet. As you go past the joint line, over that little like pizza slice of the meniscus, keep coming down, MCL still going. It's still going. It's still going. Still going. It's just here. It's just getting a little bit wavy, but it's about to insert down onto the bone. Here. You see how far down I am now on the knee? The MCL goes all the way down. And remember, around that medial side, we've also got those pes anserine tendons. So if we come back up here, we look for a couple of little blood vessels under the MCL. So there's two little blood vessels there. Pes anserine tendons are going to be these structures here, so I can spin on them and have a look at the pes anserine tendons. So again, you can see a cord-like structure running through here. It's one of the pes anserine tendons. And then we can follow them back in behind the knee. So we can see his meniscus looks okay, medial joint line looks okay. We haven't got these big marginal osteophytes here. Then we can come up, have a look at the lateral joint line. As you were, it's all right. So tibia. And this is femur. Okay. Now here's the IT band. You can see that darker structure running there. And the lateral meniscus is a bit harder to see in this light, but it's that little wedge there. So we've already seen the peripheral medial meniscus, peripheral lateral meniscus, IT band. We can have a look at lateral ligaments as well, medial ligaments. There's so much you can see on a diagnostic ultrasound if you know what you're looking for. So here's fibular head. And then spinning on that, I can get a view of the start of the lateral ligament. And then I'll have to follow that across. Not as common to injure a lateral ligament, but that's the cord-like structure of the lateral ligament there. Now, back of the knee, we can look for Baker's cyst, we can look for hamstring tendinopathy. Let's have a quick look, see what you got. This is the lazy way of doing it. Now, you can see at the top of the screen there's a little cherry on top of the cake, we call that. And the cherry is the semitendinosus tendon, and this is all semimembranosus muscle belly, so it's still a muscle belly at the moment. As we go distal, semimembranosus gets smaller. It's getting smaller there. And as we go up, semitendinosus starts getting bigger, and semimembranosus gets smaller. So that's how we tell the difference between the two. And if they have an ACL injury, and they want to do a hamstring graft, that's the tendon they're going to cut, so they're not going to have that one anymore. Oh yeah, sorry.
Let's go, mate.
There's loads of things we can show you on the knee, but I know you've got patients at once, so let me finish up there. Any questions?